What if I told you that every month your body sends you a health report in a place most people never look closely at? By the end of this video, you'll know exactly what 5 specific period colors mean, what they say about your hormone levels, and when you actually need to call your doctor. And the last color I'm going to mention? It's one that most women completely ignore, but it can actually signal something serious happening inside you. So grab a drink, settle in, and let's decode what your body has been trying to tell you. Most people assume period blood is just blood, but it's actually a cocktail. Blood, vaginal fluid, cervical mucus, and endometrial lining all mixed together. And the color. That tells the story of what's happening inside your body right now. Let's start with the one that signals everything is working the way it should, cranberry red. That rich, bright red color you might see on day 2 or 3 of your period is basically the green light from your body. Dr. Jessica Shepard, an OB-GYN at the University of Illinois, put it simply: when period blood looks like this, your estrogen levels are balanced, your uterine lining is shedding at a healthy pace, and your flow is exactly what it should be. The consistency should feel like it has some thickness to it. Not too watery, not too clotted. Now, if your flow is super light, we're talking just a few drops. That bright red can actually thin out and look a little pinker. That's not necessarily concerning on its own. But here's what the research shows. A 2014 study published in the journal Fertility and Sterility found that women with consistently light periods had notably lower estradiol levels compared to women with medium to heavy flows. Estradiol is the main form of estrogen your ovaries produce. So a persistently thin, pink discharge when you expect your period, that might be worth mentioning to your doctor. All right, so that's the baseline. Now let's talk about the color most women actually see most often: dark brown, almost rust-colored blood. This is the one that freaks people out the most. But here's what's actually happening. This is older blood. Your uterine lining sheds in layers. Sometimes the top layer comes off first, and the deeper layers, the ones that have been sitting there longer, come a little later. When blood sits in the uterus or vagina for a while, it oxidizes. Think of it like a banana turning brown after you slice it. It's not rotten, it's just exposed to air. Seeing dark brown blood at the beginning or end of your period is completely normal. But there's another context where this color shows up, and this is where it gets interesting. Many women notice dark brown spotting right around ovulation, roughly day 14 of a typical 28-day cycle. That's a direct signal from your body about what's happening hormonally. A 2019 study from the Journal of Clinical Endocrinology and Metabolism tracked over 3,000 women and found that mid-cycle spotting was associated with a 30% drop in progesterone levels in the days leading up to it. Progesterone is what keeps your uterine lining stable. When it dips, sometimes the lining sheds a little early, and that shows up as brown spotting. If you're trying to track your cycle, this is actually useful data. Dr. Susan D. Reed, a reproductive epidemiologist at the University of Washington, has published extensively on menstrual cycle patterns. Her research shows that women who track their mid-cycle spotting patterns can often predict ovulation within a 2-day window just by paying attention to this color change alone. That's valuable whether you're trying to conceive or just want to understand your body better. So if you've been dismissing that brown discharge as just normal, you're not wrong, but you're also not getting the full picture of what your hormones are doing. Now, if you're finding this helpful so far, hit that subscribe button. I drop videos like this every week, and the next one is going to be even better. Trust me, you don't want to miss it. All right, now for the colors that actually need your attention. This is the part your doctor wishes you knew, but most people never learn until something's already wrong. Pink period blood. When your flow mixes with cervical fluid before it fully exits, it dilutes the red and creates that pale pink color. Sometimes this is just a sign of low estrogen. A study in the American Journal of Obstetrics and Gynecology found that perimenopausal women in the transition phase before menopause, were significantly more likely to report consistently pink period blood. Why? Because estrogen production starts to fluctuate and decline during this time. But here's what nobody talks about. A 2021 study from Stanford University followed over 5,000 women for 2 years and found that persistent pink discharge alongside unusually light periods was one of the earliest detectable signs of thyroid dysfunction, before women even reported other symptoms. Your thyroid regulates metabolism, heart rate, and hormone signaling throughout your entire body. When it's off, everything downstream gets affected, including your menstrual cycle. Gray period blood is a red flag you shouldn't ignore. This color is almost always associated with bacterial vaginosis, an infection that happens when the normal pH balance of your vagina gets disrupted. The Centers for Disease Control and Prevention estimates that BV affects nearly 21 million women in the United States alone every year. It's incredibly common, but here's what makes it dangerous. Most women don't even know they have it. Up to 84% of people with BV experience zero symptoms. The gray discharge might be the only clue you ever get. The solution is straightforward. A course of antibiotics clears it up in most cases. Left untreated, though, BV increases your risk of pelvic inflammatory disease, which can lead to infertility. A 2018 review in The Lancet confirmed that untreated BV raised PID risk by up to 60%. That gray discharge isn't something to wait out. Get it checked. Black period blood usually starts as very dark brown and oxidizes completely on its way out. It's often just old blood from the beginning or end of your period, and that's usually nothing to worry about. But there is one scenario where black discharge needs immediate attention. If you're seeing black blood and experiencing severe cramping, fever, or foul-smelling discharge, it could be a sign of retained tissue from a miscarriage or a blocked cervix. Dr. Allison Rivlin, an OB-GYN at Mount Sinai Hospital in New York, has emphasized in her clinical guidelines that any black discharge accompanied by significant pelvic pain warrants prompt evaluation. Don't wait for it to resolve on its own. And here's the one that surprises most people: orange period blood. When cervical fluid and period blood mix, you can get an orange tint. Sometimes this is completely harmless, just a lighter flow mixing with discharge. But when that orange comes with a strong odor or unusual texture, it often signals an infection. Specifically, conditions like chlamydia or gonorrhea can produce this exact presentation. The CDC reports that combined cases of these two infections surpassed 2 million in the United States in recent years, and the numbers have been climbing. Many people carry these infections with no symptoms at all. Orange discharge with a foul smell, especially combined with pelvic pain, is your body's way of saying get tested. Early treatment is simple. Waiting can lead to serious complications, including infertility. So here's what you take away from this. Cranberry red means your hormones are balanced and your flow is healthy. Dark brown at the start or end of your period is just old blood oxidizing. Brown spotting mid-cycle, that's progesterone dropping and ovulation happening. Pink might point to low estrogen, perimenopause, or even a thyroid issue. Gray almost always means bacterial vaginosis. Orange with an odor means get STI tested. Your period isn't just inconvenient. It's data. Start paying attention to those colors and you'll catch things early, sometimes years before they'd show up on any test. If this video helped you see your cycle in a new way, give it a like, share it with someone who needs to hear it, and subscribe. Next week, I'm breaking down another topic that completely changed how my viewers understand their own bodies. You don't want to miss it. Take care of yourself.